Yeah, I'd be happy to introduce myself. And
let's see, we're ready. Anyway, we're honored to have you here. This is Stu Kerber, and he's running for hospital commissioner. And I will let him introduce himself. So,
yeah, I appreciate it.
okay.
Thank you very much. First off, thanks everybody for coming today. I really appreciate it. I know we all have a lot of demands on our time, and I sincerely appreciate everybody's engagement and just willingness to come out and listen to what I have to say. So my name's Stu Kerber, and I am running for hospital commissioner, and I'm really excited about it. I Pacific Northwest native, and 9 years ago decided along with my wife to make Port Ludlow our home, and we absolutely love it there. And I'd say more intentionally than that, we're raising our two young boys here in the community. We've got a 3-year-old, Reese, and a soon-to-be 6-year-old named Urban, and they're a energetic ball of joy is maybe the right way to say it. And I'm really appreciative to have the opportunity to raise them here. I grew up in a part of rural Oregon that feels very similar to this, and so seeing their childhood and connection to nature and ability to do all the things that I enjoy doing around us is really special. I'm an avid outdoorsman, and I spent some time this weekend with them, helping them to build a fort in the woods by where we live, and those are things that I enjoyed doing as a kid. And I'd say as a father, I'm deeply invested in the future of our community, and at the same time, I've been looking for a way to get more involved in the community and truly to be of service and put to what I believe is a somewhat unique skill set to use, and one that I think benefits the hospital board. My professional background is in finance and also in organizational problem solving. I spent most of my career to date in commercial banking, and then for the last 8 years, I've been part of a small financial services firm. And really what we do is we work with family farms in Eastern Washington and help them navigate the challenges around generational change and around financial recovery. And one of the things that I've, just a side note that I've found, is that the agricultural industry, the landscape in Washington, unfortunately looks very similar to some of the same challenges that we're looking at in healthcare as an industry right now. I was very fortunate to be introduced to Jefferson Healthcare quite some time ago. My wife, Hillary Whittington, was the chief financial officer and chief administrative officer there for 9 years. And 5 years ago, she decided to pursue another career opportunity. But what that's done for me is it's driven more than a decade of what I call dinner conversations, and conversations not so much about Jefferson Healthcare, but really more about the state of healthcare in our country and how our healthcare system works and doesn't work, and how healthcare policy affects access to communities. And I'm really appreciative of that. And from that, I started actually thinking about running for this last fall. And my reason for doing so is that the more time I had these conversations and was thinking about healthcare and the landscape of it, I had this suspicion that the landscape was going to be changing, but more importantly, the challenges to healthcare in rural communities were largely going to be financial in nature. And I felt, and I still feel, that at this point in time, I'm the best candidate equipped to handle those head on and to really help to increase the technical ability of the board in some of these areas. I think that to date, the hospital has done an excellent job of remaining financially solid and at the same time driving access and care for our community. And one of the continued themes you'll hear me talk about is that I want to ensure that the hospital remains financially sound, but I want it to more than just remain financially sound. I want it to continue to drive access to our community. And the landscape that we're facing is a challenging one. We've got increasing expenses, increasing regulations, and at the same time, we're experiencing decreasing reimbursements, all which are going to be significant headwinds for our hospital. Professionally, I've come to you're fine to oh, you're okay. So professionally, I've come to this, I guess, belief in this concept, and it's not really a novel one, is that an organization can only take on as much risk as its financial situation or financial strength allows before it risks disrupting its ongoing operation. And with our public hospital district, Jefferson Healthcare, that risk really comes through in the community in the form of creativity. And that drives accessibility to our community for healthcare. And so let me just elaborate on that a little bit. If we think about the recent things that our hospital district has done, so for example, the 55,000 square foot building replacement and expansion in the center of our hospital, that not only was needed because of seismic concerns and other things about the old building, but it added space, which is adding new practitioners and new specialties that are meeting the needs of our community and driving access to healthcare. Another great example would be the hospital's entrance into the retail pharmacy space, which is somewhere not a lot of hospitals like to participate. Or even more so, I would say a great example is the providing dental care in a clinic-based setting. It is wrought with challenges for a hospital to provide dental services. And unfortunately, just to help explain this, our federal reimbursements through Medicare and Medicaid do not recognize that our teeth are connected to the body from a compensation standpoint. So it's been a challenge. It's a difficult spot for the hospital to operate in, but yet they were able to figure it out, and they've been the first one in the state to be able to do so in our rural community. So it's really pretty special. So when I talk about I want to ensure that the hospital remains financially sound, it's much greater than I want to ensure that the hospital is just here in the future. It's that I want the hospital to remain sound so that it can continue to take on risk to drive accessibility for our community. And I think that that's really important. If I'm elected, my goals are pretty straightforward. So I've talked quite a bit about I want to ensure the hospital remains financially sound. But I would also say along that, I want to ensure that it remains also secular and independent, because I think that those are critical to being a public hospital district. And I also think that those are attributes that really resonate and reflect our community. I also want to continue to solve barriers to accessing healthcare for all of our community, but especially for young families and for our aging population. And I think that our young families are the ones that really provide vibrancy to our community. And ultimately, they're going to be the leaders that step into our shoes as time moves forward. But at the same time, we need to ensure that our older population and older community members are able to age in place with grace and really enjoy the benefits of the community that they've worked so hard to build. I also see it critically important that the hospital remains not just an excellent place to work, but the place to practice healthcare in the region. And I think that that's imperative, because as the hospital continues to grow, the hospital will need to attract talent and retain it. And we're never going to be able to pay the highest wage, but we live in a beautiful place, and I think community and culture go a long ways in being able to attract talent. in the same way, I think it's really important that we retain the employees that the hospital has, and that the hospital is able to build those skills of the employees and promote them in place whenever possible. Because at the end of the day, our hospital district's most valuable resource is its employees. And without caregivers, access to care really means nothing. Lastly, I would say that from an objective standpoint, I want to ensure that uh, I want to elevate the level of transparency at the board level, and also increase the level of professionalism at the board level. And this isn't a knock on the board, or and I don't mean it to. I don't want it to come across as disparagingly or anything like that. It's that I, I think the hospital looks very different now than it did a decade ago. And I think that there's the opportunity for the board to really level up its performance. I believe that high-performing organizations need high-performing boards because leadership starts at the top. I would also say that I believe that conflict or disagreement on a board is healthy. There should be disagreement on a board. But at the same time, that disagreement needs to be handled and resolved in a professional manner. And at no time should the staff, the hospital, or the hospital's reputation be disparaged in the public. I'm a strong believer that our public institutions work better when they're working together. And I see it largely one of the roles of a publicly elected commissioner is to be engaged, to be present, and to be accessible for the community. And that makes sense because a publicly elected commissioner in this setting for a hospital district is really the conduit between the public and the hospital district. Along those lines, I've spent a lot of time this summer reaching out and having meetings with different members of our leaders of our public institutions. So this would include city government, county government, law enforcement, fire chiefs, superintendents, executive directors of nonprofits. And my reason for doing so is a couple of things. One is I really believe in the importance of relationships, and I think that they're critically important when times get challenging. But I also was I was really curious, and I wanted to know really two things. One, what was the relationship with the hospital from their perspective? And the second thing was, where are there opportunities to either reduce friction or to collaborate? And I can tell you that largely the relationships are good in the community between the hospital and the other organizations. And I think that's what we kind of expect in our community is good professional relationships. But the other thing that I found is that there's a lot of really neat ideas that are sitting on the sidelines. And they lack an advocate or a champion to bubble them up and to drive them as part of the conversation and to explore them. And I really see that as a role that a commissioner can play. To be honest, it's something that's for me personally, it's exciting. That's a fun part of the role. And the reality is they're not all going to work, but there will be some that do, and the ones that don't will drive really fun conversations and hopefully drive access for our community. Lastly, I guess I would just say that I think that I understand what's at stake with our hospital district and our local healthcare system. And it's really, when we boil it down, it's our ability to continue with our way of life as we know it, and to live in this beautiful yet very remote part of the state. I truly believe that everybody should have access to healthcare, regardless of age and circumstance. And I'm running because I want to ensure that our hospital remains financially sound so that future generations can build their lives here as we've had the opportunity to. With that, I'd say again, thank you guys for coming out today. I'd love to answer questions, have a conversation. For me, this is the fun part of going through a campaign, is getting to meet people and also hear what's important to community members. And if I'm elected, it puts different things in my head that I need to be aware of. So I'd appreciate any feedback or questions or anything else you guys would like to talk about. Yeah.
You sound awesome, and I'm really with you, like everything you said.
Thank you.
I'm just curious. You said there were some fun ideas or some that
Yeah.
that are on your plate. So can you say anything about that?
Yeah, I can. Some of them I don't want to get too much into the technical side of it because
Yeah.
there's a lot of exploration that needs to
Sure.
be done. But um, it, so some good examples would be that the hospital has a really great program that's been established with both the Port Townsend and the Chimacum school districts, and it's really uh, a pipeline into healthcare jobs. And there's some mentoring aspects to it. There's some new technical classes that have been deployed in the hospital with some grant funding that was received. And I would say that the first stage of that has been built and is working. But there's some opportunities to scale that up now to kind of the second and third stage. And to me, that's a prime example because it's, as we think about it, we're providing career opportunities for our kids in high school, which is critically important. We're giving them an opportunity to have direction as well, and we can start building those skills while they're in high school. Some of them may choose. There's opportunities to go right into the medical field after high school. There's opportunities to go and get additional training and go into the medical field. But then selfishly from the hospital's perspective, if we can continue to build a workforce that already lives here or has ties here, that's the ideal situation. So that's one example. Another example I would share is that through reaching out to the East Jefferson Fire and Rescue, I was able to ride along with their CARES team, which is an amazing program. It's a paramedic and a social worker that ride around in a fire, basically like a Ford Maverick little pickup. And they respond to all the non-emergency 911 calls. And they're filling a critical role for our community. And there's not enough of them. There's just one vehicle, one deployment right now. When I rode with them, we hand delivered an ID to an individual that hadn't had an ID in 15 years and went blind 7 months ago and needed the ID to enroll in Medicaid to access health services. So we handed him the ID. They had previously taken him down to the DMV to get his picture taken and everything. And that we handed him the ID and then on the spot on a laptop enrolled him in Medicaid. We also spent time helping a homeless woman who was living in her car sort out her medication with her physician on the phone and get everything loaded in bottles or loaded in pill packs for the next 2 weeks, and then set alarms on her phone so she knew when to take what medication. And I think that that's a critical need in our community. And there are some ways to scale that program that makes sense and can help to support itself financially through a partnership with the fire department and the hospital. And so I don't want to go too much into the technical side of it because I'm still trying to learn more of that and understand it. But my point being is that these things, they're really neat ideas. They just need more advocacy behind them. And I think that that's a great opportunity for a commissioner. And I think you guys can tell. I mean, these are exciting things, right? Governance is governance. It's extremely important. It's not the exciting piece. These are the exciting things from my perspective. Yeah.
Along those same lines, I'm wondering if you've heard an idea somebody had. It wasn't me.
Yeah.
But I thought it was a really interesting idea. She's been really big on the idea of opening a day center for homeless people for a long time. But
Yeah.
she was saying she thought it would be great, and I thought it would be great if there was a clinic operated by Jefferson Healthcare, maybe a couple days a week, a medical clinic, because
Yeah.
it would give healthcare to homeless people and keep them from visiting the emergency rooms often.
Ye-
I thought that's a great idea.
Yeah, I
With the
think
feasibility.
I haven't, that's not something that's come up, but I appreciate you putting it on my radar.
Yeah.
There's a couple of different players in that. The Department of Health could be involved in that. The hospital could be involved in that. I think that's absolutely something that's worth looking into because preventative care is extremely important. And my understanding is that the hospital is seeing an increased load on the emergency department, and so any way to help relieve that is a benefit for individuals, and it's a benefit for our community as well. Yeah. Yeah.
As a teacher from Pilsen School District, I appreciate several things that you've talked about.
Mhm.
One is the health of a board and its connection to the community. We've had a lot of struggles in Pilsen in the
Mhm.
last year, and so I admire that that you're thinking along those lines. I also friend of my son, it brought back a memory, who grew up here, is now serving in one of the clinics at Jefferson.
Yeah.
She was maybe part of a program that encouraged her to do that. And when I saw her here, I was so happy. It was so wonderful to be able to grow your own healthcare people. in your own
Absolutely.
Community. And then what was the other one? I think that was it. I just really appreciate what you're offering and the ideas and the creative ideas being exciting to you. Those are exciting to me too.
I think that I appreciate that. I think that um, it kind of goes back to what I was talking about of just our public institutions working together and tighter community bonds and community engagement. And I think that there's a lot of the hospital is going to have some challenging times ahead with the landscape. But in my experience, one of the ways to manage that is through personal relationships and through creativity. And I think it's going to take both of those things for us to just navigate what's going to be a very different decade in healthcare than what the previous decade was. Yeah.
So I had a question. I was stuck on the woman that was homeless that you provided pills for or organized her pills. Port Townsend is full of really caring people.
Mhm.
All kinds of programs get started, but very often there's no carry through.
Mhm.
And so, was there any mechanism for her then to have some kind of a case manager or somebody to continue to help with establishing the medication?
You know, that's a good question, and it's something that's really outside my uh, area of research at this point, if that makes sense.
I've seen too many good ideas fall on their
I-
face because there was no
I,
carry through.
I
And
complete.
so good ideas are great, but
Yep. Oh,
something
there
has to go.
there has to be execution, and um, I don't understand the landscape well enough yet. It's something that I'm trying to understand. There's a lot of different, to your point, there's a lot of different uh, community services that are servicing the homeless. There's also some that have started and gone away, and it's a little unclear maybe who's here operating in those areas and what needs are being filled. Sometimes they overlap, sometimes they're different. Again, that's something that I'm trying to understand more. I know the CARES program was designed not, it wasn't, they actually have just started recently working with the homeless because there's more community support for that community than some of the other areas that they serve in. But at the same time, they go wherever the non-emergency 911 calls are. So, but as far as the other community support, I don't know well enough. That's an area that I need to research more.
And then part two of my question
Yeah.
had to do with, are you running opposed to another person? And if so, what are the differences or what do they bring to the table?
Sure. Yeah. I am running against an incumbent, Matt Reddy, and he's been on the board for 2 terms. And so I'd say I boil it down to 3 differences. I think that my my work background and experience really offers something to the board that the board does not have. There's the existing board members, I think, all bring something really valuable to the table. There's a retired physician, a retired nurse. Bruce McComas ran the mill. He's very strong operationally, but there isn't a real strong depth in the financial side, and I think that's something that I offer. I would say that I bring a different level of leadership and professionalism that I think the board is ready for. Like I said, the organization is very different now than it was 10 years ago. I mean, to give you an idea of scale, the annual operating budget for last year for the hospital was $190 million. It's the largest employer in the county. They have over 1,000 employees. So it's not a little business. It is a large operation and very complex. And so I think I bring a different level as a board member. And then lastly, I would say is I think that from a campaign standpoint and objective, I'm really focused on the future on going forward. I'm not real interested in litigating the past or what the board has or hasn't done in the past. I think it's important to know, but my perspective on a lot of it's very different. And really, I'm out talking about the things that I matter, that I see coming, because I think that's what's important. And so I would say that's a big differentiator. Yeah, absolutely.
What part of Oregon?
I grew up in Sherwood, Oregon, which is south on the I-5 corridor, about half an hour from Portland, just outside the urban growth boundary, kind of by like Wilsonville, Westland, Tualatin area. Yeah. Yep.
I have
Yeah.
a question having to do with the continuing to be a secular facility.
Yes.
And do you think that there is a pressure there or a danger there that we might, what would cause us to lose that?
Yeah, that's a really good question. So let me. A good example might be Olympic Medical Center. Olympic Medical Center is in really challenging times.
That's the
Port Angeles, yep, is in really challenging times financially right now. And there's the risk that they could close, or there's the risk that they could go into bankruptcy. And let's say a large religious hospital system bought those assets, it could still remain a public hospital district, but it is now a subsidiary of a large religious hospital system, which is then going to drive decisions around accessing care. And so I think that's the most direct path. The hospital does have affiliations. I know that they have a affiliation, I believe, with Providence. And that was largely to get access to Epic, which is the health record system. But even as I understand it, when that was negotiated, they put special terms and language in there to ensure their independence and that they were secular, because even the contract for Epic had things in it that could affect. So I think it's, I don't see it as a immediate risk, but I think it's something that needs to constantly be on our minds from an objective standpoint, because it's really easy to open the door in a way that we think is a good decision at the time and could have detrimental effects down the road.
So it's a high priority.
Absolutely. I really believe that. And I think that that's something that our community really wants. And it's something that I've gotten a lot of feedback on.
So was that a driving force behind the attempted relationship with Olympic?
I don't know. I would say, my information on the Peninsula Health Alliance is kind of limited to everybody else's, because I wasn't involved in the process. But what I would say is, I think it was a neat idea, and partnerships are going to be important, because from how I understand it, the structure allowed both hospitals to remain independent public districts with their own boards, and authorities would remain locally. they would have then a shared relationship where if they could, for example, use volume discounts because they'd be buying for 2 hospitals to drive down costs of service of goods, or if let's say Jefferson Healthcare has demand for a specialty physician 2 days a week, and Olympic could handle them 3 days a week. Now both hospitals can hire that person where that wouldn't exist before. So I think it was basically an opportunity to have some creativity around how sharing of resources. And the reality is that the dotted line between the counties is really just that. It's a dotted line. And we have, in our community, we have a lot of people that go to SQUIM for medical services, especially historically if the hospital hasn't offered them, our hospital here. And right now what we're seeing is that roughly 25% of the emergency department volume at Jefferson Healthcare is coming from Clallam County. And that's largely being driven by wait times in their ED, which can be 8 to 10 hours at times. So I think that we as a community have a vested interest in Olympic Medical Center's success.
Do you think that is dead, or do you think there's still?
Yeah, it's dead. They awarded the opportunity to University of Washington, so that's their partner. That doesn't mean that there won't be opportunities for something in the future, but I think at this point, Olympic Medical Center really needs to figure out what their path forward is. But I would imagine, I don't know. I would imagine that they place a premium on remaining secular when they chose a partner, but I don't know. I know that we very much would in this community. So, yeah. Any other questions or thoughts or anything I can answer for you guys?
Great.
Yeah. Very normal.
No,
I'm
absolutely.
still concerned about the fact that many people have to cross the bridge and go to Hallsbow and Silverdale to
Yep.
have, to see doctors and to have things done and so forth. I would like to see that. I mean, it has improved.
Yeah.
In recent years, but there still seems to be a lot of that that I'd like to see happening here if it could.
And I know the timeline on some of those can be long. So I'll give you an example. If you guys have followed anything with the hospital, with the new building, they've done a lot of publicity around the fact that they've been able to add a linear accelerator. And that linear accelerator, I know that that's a project that they've been talking about for over 10 years. And I can tell you that because I know my wife looked into it way back when I was first moving up here. So, and it's taken a long time to get to the point of being able to offer that for the community. And really the way that they were able to do it is that the Jefferson Healthcare Foundation raised $2.5 million here locally in donations to purchase the equipment, which is pretty amazing, I think. But talking to people and out in the community, something like that really makes a difference, because the way that radiation treatment is handled is usually it's 4 to 5 times a week for 15 to 20 minutes. And, some of us are very fortunate to have the luxury to have transportation, but not everybody in our community does. And so it can, for some of us, it can make the difference between being convenient and being inconvenient. For others in our community, it can make the difference between can they get the treatment and can they not. And so I think it's really cool that our hospital has been able to continue to drive access and look at ways where they can meet the community's needs. There's always going to be a challenge because we're a critical access hospital. So we're as a hospital district, we are limited to 25 inpatient beds, and we can't exceed that. So, but there's a lot that we can do as a hospital district in outpatient services and specialty services, et cetera, to continue to meet the needs.
You mentioned the pharmacy. I didn't understand
yeah.
what that was.
Yeah, so a few years ago, Jefferson Healthcare opened a pharmacy in Port Ludlow. So there's when you go to the doctor, you can actually have your prescription sent to the Jefferson Healthcare pharmacy in Port Ludlow, and they are in process. I believe they're in the middle of construction right now of opening a second retail pharmacy in the upstairs of the Sheridan Clinic. So the Sheridan Clinic right across the street from the hospital, the upstairs, a large part of that was where all the executive offices were, because they tore down the middle of the building where they were. Well, since they've finished that, they're moving back into that space, and so they're converting that space into a retail pharmacy. So we'll have a retail pharmacy service right there, and it's pretty. There's a lot of statistical work that's gone into how outcomes of patients. And the faster you're able to get them prescriptions with the least amount of friction, the better the outcomes. So by having the prescriptions right there where you can leave the hospital or leave your primary care physician and go right to the pharmacy to get your medicine versus calling in and then remembering that you have to make a separate trip somewhere else and it's not available right when you want it, et cetera. It creates it's a nice revenue source for the hospital to offset other areas that don't fund themselves. But it also is really important, I think, in helping to drive access and drive outcomes for our community. Yeah.
Can they compete with the mega pharmacies or Safeway, or is the cost going to be higher to the patient?
My understanding is no, and they actually have the ability to purchase as part of this. They're going to be getting a special license to buy the extremely expensive specialty drugs at the wholesale cost that any other specialty pharmacy would. But then the difference is that I'm not sure where they fall in the pricing. I know it's not higher, but then also it creates revenue for the hospital, which is really important because as we look at decreasing reimbursements, that's one thing that the hospital is going to have a challenge with. But there's always an offset in providing hospital care. And a good example is the OB or birthing in our county. The hospital averages about 90 babies a year. We're not a young population. There's just not a lot of kids being born here. So that's less than one baby every 3 days. And it's, there's no way financially to make the math work on that when you think about staffing a birthing unit. So it's real important that the hospital is able to then generate net income somewhere else to kind of offset that to keep the operations moving. But more importantly, it's that's one thing. But if it doesn't drive access and care for our community, then what's the point, right? So I really see that as a nice benefit to things like the pharmacy. Yeah.
I just want to say that I often put off making appointments for clinics that are in Silverdale or Bremerton or someplace. So I put off dermatology for several years until now when they opened a clinic.
Yeah.
So I'm so happy about that.
Oh, it's great. I mean, it's true. And unfortunately, there still can be long wait times to get in and get established, and that's something that I'm sensitive to and want to understand better. I know that it's across our entire healthcare industry, and we as a community, our needs and utilization for healthcare is increasing. And so there's more capacity limitations than what there have been historically. But it's really important because, again, that's, as I talk about access, that is a barrier to access. And I've experienced that with my kids, getting them into specialty services. We had one of our sons needed to see a specialist, actually 2 specialists, and the first one was 7 months to get into, and the second one was 6 months to get into. So we were 13 months from the primary care visit saying, hey, this is the next step to where we could even see the doctor. And fortunately, it wasn't anything that was an emergency, but those timelines matter. And it's something that I think as a community, as a hospital district, we need to be very aware of and try to actively manage.
Well, if there aren't any more questions, I thank you. Oh, you
Sort
have
of
a
statement.
question?
Yeah.
Thank you for what you're doing.
Yeah.
I moved here 10 years ago from the East Coast, from Maryland.
Mhm.
And there's Maryland, sort of like Washington is split by water.
Mhm.
So there's the Baltimore, Washington, D.C., Annapolis side, and then there's the Eastern Shore, which is rural. And two of the towns that we lived in, the hospitals got bought,
Mhm.
and they stopped servicing the town the way they were, like a functional hospital.
Mhm.
They became like emergency room beds, and even emergency. And then they were purchased by, like, one was by Hopkins, another was by University of
Mhm.
Maryland, and they would have a helicopter pads and pretty much anything.
Yep.
There were no babies delivered at all. So the town, you want to try, and even though I'm surprised there's 90 babies delivered.
Yeah.
But I would like to see more,
Mhm.
because I, like you, I believe, to continue attracting youth,
Mhm.
to keep this a vibrant, thriving community. Also the secular piece, I'm in a transgender marriage.
Mhm.
And, it's terrible when
Mhm.
you try to get some treatment, and because a hospital is a religious background, may
Mhm.
not treat you
Yeah.
for certain things because it's against their faith.
Yep.
Or whatever. And it's pretty devastating.
Yep.
We had to go 2 hours to Philadelphia
Yeah.
to get some treatment.
Yeah.
And just talking to the doctors. I mean, my wife had a colonoscopy and was insulted by the anesthesiologist. And if she hadn't done all the prep,
Mhm.
she would have gotten up and walked out.
Yeah.
Because, here's this person that's going to put me under and be in charge of my life, making a joke about my gender and about me.
Yeah.
And it's just, and then to try and get somebody to do something about it, the hospital wouldn't even, they sort of sent an apology that said, oh, it was not one of our regular anesthesiologists.
Yeah.
It was a visiting.
Yeah.
physician,
No
so there's nothing
accountability.
we can do.
Yeah.
And it's like, no, you track the person down and get an apology in
Yeah.
writing, and educate that person. We've had wonderful healthcare experiences
It's great.
here, and I'm praying that it stays things. With all these rumors about Medicaid being
Mhm.
cut, I mean, what kind of impact will that have on that hospital?
So first, I would just say
That
that,
might just be a big deal.
yeah, well, no, I think it's going to have an effect. So first, I would say that again, when I was talking earlier, I believe everybody deserves access to healthcare, and I also think that healthcare, or the care relationship, is a very personal one, and it always makes me really sad when I hear about poor experiences or interactions of this type, where somebody's just looking for healthcare, and nobody should be uncomfortable in doing that. And I'm happy to hear that the hospitals had a good track record of this. That's my understanding as well. As far as the threat to from Medicaid and the cutbacks, there's going to be as of right now, there's roughly $1 trillion coming out of Medicaid. What that likely means is, from what I've seen, what I've gathered from what the hospital's done from a modeling standpoint, is that they think about 3,000 members of our community could lose Medicaid coverage. And with that, the hospital still is going to care for those members of the community because it's a public hospital district. That's what they do. But they're going to incur the expense, but they're not going to have the offsetting or their revenue, basically, to help cover that expense. So they kind of get hit twice with that. The hospital has been, Jefferson Healthcare has, from what I understand, one of, if not the most generous charity care plan in the state of Washington. And so they look at charity care and then what they call bad debt expense, which is essentially where they write off medical expense or medical bills. And last year in 2024, that was $9.2 million total that they essentially just wrote off. And that comes out of their earnings. In this year, when we look at August numbers annualized, we're going to be at $12.5 million. And so there's been significant growth in the need in our community. And we really haven't had any of the effects of the change in healthcare reimbursement yet. So I think that's going to be something, as I think about, things, if I'm elected, what are the issues that I'm going to have to deal with in the near term, say in the next 24 months. I think that's going to be a real issue, because at some point the hospital is going to hit its capacity and how much it can absorb of that. And there's a couple of different levers that can be looked at. One is, does the policy need to be revised? I think that it's providing access for our community, so I don't love that idea. I don't think there's a great idea, right? But we, as a community, we also pay the second lowest public hospital taxing levy in Washington state. So as a public hospital district, some portion of our property taxes go to the hospital. As of last year, the total tax revenue for the hospital from the county was $530,000, and that's on a budget of $190 million. Wow. So it covered less than one day's operations of the hospital. And another way to look at it is that the hospital is receiving, so this year I think the hospital will get somewhere about, $560,000, $570,000 in tax revenue, and they're going to write off $12.5 million in expense. So it may be, I don't love taxes. I don't like increasing taxes, but it may be that there has to be a conversation about increasing the levy if that's how the hospital is able to continue to fund charity care and drive access to our community. So I think that there's going to be some challenges around changes in decreasing reimbursement. And then the other piece of it is that expenses are increasing as well. Expenses in the hospital space are almost twice that of what inflation's been. And so it's a challenging landscape. What I will say, I don't want it to be all doom and gloom. I think that our hospital is probably one of the best positioned in the state of Washington to go forward. As of mid-August, 70% of hospitals in Washington were losing money. It's the same, almost exactly the same statistic as last year. And over the last 4 years, Washington hospitals cumulatively have lost $4.9 billion. Oh my God. So its reserves are getting drawn down low. We're starting to see layoffs with a lot of hospitals. Seattle Children's Hospital laid off 151 people 2 weeks ago. Valley Medical laid off 100 people about a month ago. So it's a different reality. All of that being said, our hospital is still profitable, and they operate at small margins. It's about right around 2% is a kind of the statistic. 2.2% is the 5-6 year average operating margin for our hospital. But we as a hospital district are much better positioned going forward, but we're still going to have challenges. And especially if we want to be as ambitious as what we have been with charity care and driving access for the community.
You said 3,000 people will be affected.
That's what Mike talked about it at one of the board meetings. Mike Glenn, the CEO, that
That's a huge percentage.
It is a big percentage, and I don't have insight into how they calculated that, but they thought that it was going to be up to about 3,000 members of our community that would lose access, and so that's it has a real impact more than just financial for the hospital. I mean, it has an impact to community and to access.
Wow. We have a lot of challenges ahead.
Yeah, there are, and but again, I will say that I think we are lucky that we live somewhere that one, I would say we're able to because we have such a good local healthcare system, especially as people think about retiring and aging in place. That is, as I'm out talking in the community, that's something that keeps coming up. Is I moved to Port Townsend or to Jefferson County X number of years ago, and one of my deciding factors was that there was a good hospital here, a good hospital system, and I firsthand seen the opposite of that. I had a good friend and coworker who was close to retirement, owned a lot in Port Townsend, and 15 years ago decided that the hospital wasn't strong enough. And the hospital looked very different at that point in time.
Yeah.
And they sold their lot and they ended up moving to Coeur d'Alene, Idaho, because
And it wasn't when we moved here either 25 years
Yep.
ago. And his mother, we were trying to get her to move here, but we didn't want to.
it looked very different. I at one of these events the other last week, there was a woman who said that she was born at the hospital 51 years ago,
Wow.
and how different the hospital looks versus when she was a kid. And her comment was really cool. Was I never imagined that our hospital could look like it does now.
Yeah.
And it's pretty cool to think about because we're a small county in a rural area, and to have, this level of dynamic healthcare is pretty darn amazing.
Yes, definitely, yeah.
Yeah. We want to keep it that way. I mean, that's it though. I mean, it's critically important to our community and to the health of our community. And I think that, as the next decade will look very different for Port Townsend than the last decade has. And hopefully we're able to continue to grow in a managed way and, attract, younger families and things like that. But healthcare will be a part of that. It's a larger and larger part of people's decision making in this day and age.
How long is the term that you're
That's a good question.
Oh, yeah.
So it's a 6-year term. They're actually quite long terms, which is surprising. There's all the different city and county roles and boards and stuff all have different structures, different terms. So some of them are 6-year terms, like the hospital district. One of the other things that's a little different with the hospital district is there's no geographical requirement. So you have to be in the county. But as we think of like county commissioners, everybody votes for the county commissioner, but the county commissioner has to come from one of 3 districts. So there'll be like a Port Townsend, Chimacum, Hadlock, and then South County, Quilcene, Brennan area. And for a hospital district, that isn't the case. And so that's actually one of the things that's a little different about me is that I do live in Port Ludlow, where all the other commissioners live in Port Townsend, or one lives just right on the border of Port Townsend. And so I think it's important to have some geographical diversity in the board, especially as we're seeing a large, probably the largest need in our community is as we go towards the south end of the county, and Quilcene Brennan area absolutely has a need that's not being fully serviced, and there's been a lot of growth in services in the Port Ludlow area. They've opened a clinic about 5-6 years ago. They opened the retail pharmacy, and they recently bought the Kitsap Bank building in Port Ludlow, and they're going to be turning that into an imaging and specialty services center. So that's a pretty cool project that they have going. So, but I think that, again, it just kind of comes back to community engagement. And so having somebody present in the community that, represents the interests of the community on the board, I think is important.
What would success look like to you at the end of 6 years?
What would success? That's a good question. A couple of things. I think that the hospital is financially sound, and more than financially sound, that the hospital has been able to continue to drive access for our community. I mean, to me, that's the largest measure of success. But I would also say that as a community, we have a very transparent and professional board that's leading from the top. And the board's role isn't to get into operations. They hire the CEO to do that. They have one employee, and that's very important in that role. But it's a critical. I think that as the organization has grown, the skills, experience, and professionalism of the board need to grow as well to reflect that. And so I think if we've got a more transparent, more professional board at the end of 6 years, I think that would be another significant measure of success.
Who are the board members now?
Yeah, so that's a good question. Case Kolf, who he's a retired physician. Mari Dressler, yep, and she's a retired nurse. I believe both of them have 2 more years on their terms. And I don't know if they're planning to run again or not. And then Bruce McComas, who ran the mill. He's been in Port Townsend for quite some time. I think he's got 4 or 5 years left on his term. Jill Bueller is the chair. She is stepping down at the end of the year. I think she's been on for 5 terms now. So she's been a staple for a long time. And then Patty Roden she's running unopposed for Jill's role. And I think Patty will be a really good addition to the board. She is currently the chair of the Jefferson Healthcare Foundation. So she's been in the community. I think she's been in the community for 3 or 4 years now. She and her husband retired and moved up from Arizona, and she was she's either I don't remember, the chief financial officer or chief operating officer for a large hospital system in Arizona. So she's got pretty good operational healthcare experience. She's running, but she's for Jill's position, and so she's running unopposed. And then I'm running against Matt Reddy for my position. Yep. So I think that there's a good opportunity to have a pretty experienced and cohesive board coming out of this. He worked for Jefferson Healthcare for about 10 years in performance improvement. And outside of that, I don't know.
Do you have any leaflets or buttons or anything?
I am out of buttons, but I haven't gotten my kids to figure out how to use the button maker yet, but they sure love me having a button maker because now we've got Ninja Turtle buttons and Transformer buttons, and you know, if it prints, Dad can make a button out of it. But I do have some flyers that I can leave. I've got 1 sign left. I ordered 50 more and received them last Monday, and I'm down to 1. So if anybody has a good spot for a sign, I'm happy to give you one. Yeah, perfect.
Yeah. I think San Juan is the best place in this area.
Yeah.
I don't think any of us have.
No, we're not.
Yeah.
Nobody really drives by.
But I do have some rack cards, which I'll leave some here that have information about me and whatnot. Yeah.
What's the best way we can support you? Directly or online?
Yeah, so I appreciate it. That's a good question. The best way to support me is really to talk to your friends and neighbors. That's the biggest thing. I'm very excited about the role. I think hopefully that comes through as I talk. But at the end of the day, it's not, a hospital commissioner isn't the most glamorous thing in the world of things. And so, that doesn't bother me any. But my point with that is that we've got an off-cycle election, and there's very limited stuff from the state on the ballot, and there's only a few city and county races. Yeah. And largely the public, there's a small percentage of the public that's very engaged, but the majority of the public isn't real engaged, and it's understandable. They've got a lot of demands on their time. And so turnout is always a challenge in these off-cycle races. And so the best thing that you can do to support me would be to get the word out, talk to friends, talk to neighbors. I mean, those quick little, 30-second conversations really go a long way. I have a good website that I spent a lot of time on, which is just Kerber, my last name, Kerber, Kerber for Health. And I'll put it, when I leave some rack cards, that has the contact information on there. That's another great way. And, there's more just more information on me, and it's a good way if somebody doesn't have the opportunity to engage with me directly to learn more. The League of Women Voters will be this Thursday at 6 o'clock. We have Matt and I have a debate on there, which will be the only formal debate for the process. Excuse me. That'll be another great way for people to engage. And it's going to be so they're doing it all over like Zoom. But also KPTZ is going to be airing it live at the same time. So that's another great way to listen to it. So, and then, yeah, and my contact information, I mean, I'm always happy to.
Letters to the editor.
Letters to the editor are fantastic. If anybody is willing to write one, they are fantastic. And fortunately, our newspaper does a pretty good job of publishing, some of them at least. And I'm always, I'm always happy to visit and talk to people. And so if anybody has a question, feel free to reach out. I mean, that's one of the things, and I want to make sure that I'm available. And so that's a pretty critical piece. But
what's the voting timeline? Like you said, mentioned the ballots.
Yeah, so ballots will come out. I believe they get released on tomorrow, and they should be in the mail on the 17th, which is Friday. And the voter's guide should come out here pretty quick. I'm surprised actually we haven't received it. Did it? Well, the state one did.
But
The
not
county,
all.
yeah, because I got excited. I opened it up and was just excited to see it. And then I was like, where's all the people?
Just the
Um,
information.
Yeah. And so basically voting starts as soon as people have their ballots. And there's campaign-wise, there's a big push between now and Friday. And then a lot of the public's, forums and things like that, they're all front-loaded before the ballots drop. But there's a lot of people that don't vote until, I typically don't vote until kind of last minute. And then I always get it in, but I'm not the first one to vote. I can tell you that. So there's a lot of that too. So it's, I'll keep visiting with people and just getting my message out. I mean, at the end of the day, that's what I'm wanting to do. I'm excited about the opportunity. I'm excited to be of service. I really want to do a good job at it. And I think that there's a really cool opportunity to help lead our hospital district into kind of what the next stage of it looks like. But, at the same time, I mean, my goal is to just get out, connect with people, get my message out. And if it resonates, then that's great. I mean, it's the way that this whole system's supposed to work. So it's exciting to go through. And like I think I mentioned somebody earlier, if I'm elected, I will be a much better commissioner having gone through the process. And I think that that's actually pretty cool.
Thank you.
Yeah, thank you guys. I really appreciate it. Like I said, this is the fun part for me. So thank you guys.
That's great.
And
Yeah.
we all have mouths that we can pass on to
Yes.
other people. who
Yeah,
learn
that's
from
great.
Yeah.
Yeah.
All right.
All right. Thank you guys so much.
Thank
Sending
you.
out the invitation.
Yeah, thank you for inviting us.
You've been very inspirational.
Well, that's good. I appreciate that.